obviously sort of, we could look for any scarring, which we would see. Nice bit of scarring here, which is good. Okay. Now, obviously sort of, with Marie, what we would do, sort of, you would then sort of, see if there was any sort of, tenderness in the abdomen as a whole.
Bisogna valutare con Marie se appunto ha indolensimento generale nell'addome.
Then you would want to sort of, palpate sort of, the lower left quadrant, the central left quadrant, sorry, central quadrant, and then
centrale e poi a destra.
So, lower left quadrant, come into the where the ASIS is, and then sort of, you would then just gently press in. Okay. And then sort of, central, to check the bladder. Okay. Then sort of, the lower right quadrant. Okay. So you curve your hand in. So if you think about the actual uterus, about the size of the patient's fist.
L'utero è grande come
il pugno. Okay, so just make a fist for me. So we just pop that sort of, to there. It's going to be approximately that size. So normally you can't actually sort of palpate it. Okay. If I come in, palpate either side. All right. You can, if it's enlarged, you will feel it between your fingertips here.
Lo sentite qua.
So you obviously sort of palpate either side, and then sort of, you could possibly, if there was sort of an enlargement to the fundus itself, you'd be able to get it between your fingers.
Riuscite a tenerlo tra le dita.
And you can rock it from side to side, and you would feel any enlargement or fibroid accordingly.
Dovreste riuscire a sentire dei fibromi o l'ingrossamento dell'utero.
So in Maria's case, there would be sort of, tenderness in the central quadrant itself, in the lower aspect, because we've got sort of, the bladder is not happy.
Di Maria ci sarà un indolensimento, dolore nella parte bassa centrale.
Chances are sort of, you would actually sort of feel the actual sort of uterus was enlarged because of fibroids.
E probabilmente riuscirete anche a sentire che l'utero è ingrossato a causa di questi fibromi.
It's going to be tender, but not exquisitely painful.
Ci sarà un indolensimento, dolore, ma non proprio un dolore molto particolarmente acuto.
So obviously, sort of, that would be our special examination that we'd have to carry out.
Questo è l'esame specifico che faremo
in questo caso. The other one would be sort of, to test the symphysis pubis. What we do there is just push your knees together for me. So just squeeze together. Right, so as the patient squeezes their knees together against my hand, all right, if there was sort of, irritation to the pubis itself, that would be uncomfortable.
Se ci fosse un'irritazione alla zona pubica, provocherebbe dolore.
Other sort of, biomechanical issues would be, just drop your legs down for me. Okay. We would then sort of, come onto the superior aspect of the symphysis pubis itself, just palpate it, just to see if there is any incongruity in the two halves of the symphysis itself. All right. So we just gently palpate on top. All right. Just palpate the tissues there and see if there's any tenderness. We can then assess the movement of the symphysis pubis by getting the patient to lift their right leg up, please. Right, and the right thumb should come up, then the left one. And that movement should be equal. If it's tender or painful in any way, it indicates we've got inflammation of the joint.
Se c'è qualche dolore ci indica che c'è un'infiammazione dell'articolazione.
Okay, right. So let's all sort of, pair up and do a quick abdominal examination.
Mettetevi in coppia e fate un esame.